bring in now Dr. Ashley Frawley, who's a senior lecturer in sociology and social policy at Swansea University over in the UK. Thanks so much for joining us, Doctor. First of all, you've written an article, I know, about so-called experts exploiting the heightened sense of fear that exists right now. Who exactly are you talking about here who are, taking advantage?
So my research really looks at what I call therapeutic entrepreneurs. So people whose bread and butter, so to speak, is the advocating around social problems that they claim are, the biggest problem facing us. And I started to notice as the Covid-19 crisis was growing that many advocacy groups were claiming that it was a mental health crisis as big as or even bigger than the health crisis itself. And so I noticed, even just on Facebook, the advertisements, because I do this kind of research, I get a lot of therapy advertisements misdirected at me. And one of them was saying, anxious about the state of the world, talk to an online counselor. And I clicked through, just $70 a week. You can talk to somebody about your anxieties, about coronavirus. There was hypnotherapists, there were mindfulness practitioners offering guided meditation to frontline health workers, introductory offers on meditation apps, things like that. So I've noticed that there's this move to sort of redefine this situation, which is definitely quite anxiety-inducing, but to redefine that not only as it's normal to feel anxiety, but also that anxiety is a kind of illness. So it becomes normal to be ill and in need of professional intervention.
Like you said, I've noticed this as well, that a lot of services being offered. Begs the question, is there a genuine problem with mental health at the moment? And if so, what should we be concerned about?
Well, certainly for people who have pre-existing mental health conditions, being locked inside your home is not going to be particularly good. People who are homeless also tend to experience higher rates of mental health problems, and obviously that is a serious issue. But what I've noticed is this tendency to see everyday anxieties and uncertainties that are, people are going to feel right now, to see that as a mental health problem. And I'm not so sure that it's helpful to medicalize our anxieties, because if you define something as a medical problem, then the solution is medical. If you define something as a social problem, then the solution is social. So, we need to get creative about trying to connect with each other and things like that. And this is not something that you can pay for over the internet or over the phone. It's something that you have to share with other people. And a lot of people are doing that, absolutely. But there's this tendency to kind of medicalize our fears, medicalize our anxieties, and then to sort of cash in on that. And, the long-term effects of that are quite profound, because particularly, so in the United States, for instance, they've relaxed some of the restrictions around prescribing. So you can prescribe psychotropic medications without seeing a patient face-to-face. Now, some of that absolutely is necessary. People will need to be able to access drugs. However, if these are new prescriptions around the sorts of anxieties that we're experiencing now, even profound kind of uncertainty and anxiety and difficulty, well, after that, you have to think about how difficult it is to actually come off of these kinds of medications. And so that you have to think not only about trying to make things easier for people now, but also thinking long term. If we relax these kinds of restrictions, there's also a relaxed restriction around in the UK around being able to section people on mental health grounds. Again, maybe necessary in an emergency situation, but after that, how long will it take for people to get their cases reviewed? So it's an important thing to think about, to be careful about medicalizing our everyday fears. Yes, there are people with serious mental health issues, but there's also just a wide range of emotion that just exists in the population that's maybe not something that needs to be professionally treated.
You talked about the increase in the use of psychotropic medication. There's also a number of drugs sort of rumoured to be beneficial in treating the symptoms of Covid-19. No cure, of course, as yet. Do you think the pharmaceutical companies are taking advantage of this? Are they cashing in?
I'm I'm not entirely sure in terms of the sort of physical treatments for coronavirus. I mean, I think it's necessary probably, things are moving very, very quickly, and it's very hard to go through the phases that are necessary. But I definitely know that looking at past crises, there has been a tendency for pharmaceutical companies to see them as psychological problems, particularly in China. There's this tendency, a growing tendency to medicalize everyday anger and frustration. And when workers get laid off and and factories shut down, there's a tendency to kind of medicalize and individualize their anger and frustration, because that's a very kind of dangerous sentiment. If people come together and see their anger in a social sense, they may band together and maybe take over the factory or something like that. And so there's a lot of sociological research that looks at the way that that medicalization of that frustration and anger individualizes, and on top of that becomes this boon for this enormous psychological industry, psychopharmaceutical industry, and it's worth a huge amount of money in China, and it's growing annually. And crisis is definitely exploited and has been exploited previously.
Dr. Frawley, great to speak to you. Really appreciate you coming on. Thanks for your time. Dr. Ashley Frawley, my guest, Senior Lecturer in Sociology and Social Policy at Swansea University. Thank you.